Okay, let's get into this. Cervical cancer.
Yeah.
We're talking about cancer that starts right in the cells of the cervix.
Hmm.
And, the really key thing right from the start is HPV. Human papillomavirus. It's behind most of these cases.
Almost all of them, yeah.
So today, we're doing a deep dive. We want to understand exactly how this happens, what the first signs might be, those subtle signals,
Right?
and importantly, what can be done, treatment, and maybe even more importantly, prevention.
Exactly. We have looked through some really good information, and the plan is to pull out the absolute must-knows. The symptoms, why HPV causes it, how it's treated, and like you said, how to prevent it.
Yeah, because medical stuff, it can feel really overwhelming sometimes, can it? Like a maze.
It definitely can.
So think of this as maybe a clearer path. We want to give you actionable insights into cervical cancer, focusing on what really matters.
Sounds good. So maybe start with a really crucial point. Early on, cervical cancer often has, zero symptoms, nothing you'd notice.
Right. Which immediately tells you why regular screening is so important.
Absolute critical.
Okay, but let's say it does develop a bit. Stage I, for instance. What might someone notice then?
Okay, so you might see some watery or perhaps bloody vaginal discharge. It could be kind of heavy, maybe even have a noticeable smell.
And bleeding too.
Yes, bleeding is a key one, like vaginal bleeding after having sex or maybe between your normal periods.
Or if you've already gone through menopause, right?
Yeah.
Any bleeding then is a flag.
Definitely. And another thing sometimes is pain or discomfort during sex. The medical term is dyspareunia.
Okay, so those are potential early signs. What if the cancer has spread a bit more?
Right, if it's moved beyond the cervix, unfortunately the symptoms can become more widespread. You might have trouble urinating, maybe pain, or even see blood in your urine.
Oh.
Bowel changes too, things like diarrhea or pain, maybe even bleeding when you have a bowel movement.
And more general feelings, like just feeling unwell.
Yeah, exactly. Like persistent fatigue you can't explain, losing weight without trying, maybe losing your appetite, just feeling generally off.
That sounds tough. Anything else?
Sometimes a dull ache in the back, or maybe swelling in one or both legs, pelvic pain, abdominal pain, those can also happen.
Wow. Okay, so the bottom line here is, if you notice any weird bleeding, any unusual discharge, or just symptoms that don't feel right and stick around.
Talk to your doctor or your healthcare provider.
Yeah.
Always best to get it checked out. Don't wait.
Absolutely. So let's pivot to the cause. We mentioned HPV. Can we unpack that a bit more? How does HPV actually lead to cancer?
Yeah, so human papillomavirus, HPV. It's incredibly common. It's a sexually transmitted infection passed through, any kind of sexual contact, anal, oral, vaginal.
Then most people get it at some point.
My estimates are huge, yeah. Something like over 80% of sexually active adults will get some type of HPV. But, and this is key most of the time, your body's immune system just clears it.
Without you even knowing you had it.
Often, yes.
Yeah.
No symptoms, no problems, it just goes away.
But
Not always.
not always, and that's the issue. If the HPV infection, specifically a high-risk type, persists, sticks around for a long time, that's when it can start causing changes in the cervical cells.
Changes that can eventually become cancer.
Exactly. Over time, these abnormal cells can develop into cancer cells.
You mentioned high-risk types. How many are there?
Well, there are over 100 types of HPV identified overall. Most are low risk. They don't cause cancer. But there are about maybe a dozen or so types that are classified as high risk.
And those are the ones linked to cervical cancer?
Yes. And finding these high-risk strains early through screening is really a cornerstone of prevention. These particular HPV types have proteins that mess with the normal cell growth cycle.
Okay, that makes sense. And this is where the HPV vaccine comes in.
Precisely. It's a major preventative tool. The vaccine protects against the specific HPV types that cause the vast majority, we're talking up to 90% of cervical cancers.
That's huge. So beside the HPV itself, are there other things that increase someone's risk? Things maybe you can control? Yes, definitely. One big one is screening history.
Right. We keep coming back to that.
Because it works. If you don't get regular Pap tests, your risk goes up simply because you might miss catching those precancerous changes when they're easily treatable.
Makes sense. And having an active high-risk HPV infection, obviously.
Obviously, yes. And then there's sexual history. Starting sexual activity younger, say before 18, or having many partners over time, that increases the chances of getting HPV in the first place.
Okay. Anything else?
Smoking. Smokers have a significantly higher risk of cervical cancer.
Wow, I didn't realize it was that significant for cervical cancer specifically.
It is. It seems to damage the DNA in cervical cells and might also weaken the immune system locally in the cervix, making it harder to clear HPV.
Interesting. What about immune system issues generally?
Yes, having HIV increases the risk, and really any condition or medication that suppresses the immune system makes it harder to fight off infections, including HPV. So that increases risk too.
Got it. Are there risk factors you can't control?
There are a few. One is exposure to something called DES, diethylstilbestrol. It was a drug given to some pregnant women between about 1938 and 1971 to prevent miscarriage.
So if your mother took it while pregnant with you,
You might have a slightly increased risk. Yes, it's not a huge risk factor for most, but it's there for that group.
and family history, does that play a role?
It might. There could be a genetic component, suggesting some people might be predisposed, but the research is still kind of ongoing there. It's not as strong a link as, say, HPV or smoking.
Okay. Now, you mentioned precancerous changes. How long does that process usually take, from those first changes to actual invasive cancer?
It's typically quite slow, which is, well, it's good news in a way. It often takes somewhere between 3 and 7 years, maybe even longer sometimes.
3 to 7 years. That really drives home the value of those regular Pap tests again, doesn't it? Catching it in that window.
Absolutely.
Yeah.
That's the whole point of screening, to find it before it becomes cancer.
And if it does go untreated, what are the potential complications down the line?
Well, it can cause significant pain. It can affect how your bladder and bowels work. In more advanced stages, it could even lead to kidney damage.
That sounds serious.
It is. There's also a higher risk of blood clots. And if the cancer spreads, metastasizes.
Meaning it goes to other parts of the body?
Right. Then you might get bleeding from the vagina or the rectum or the bladder. And for people wanting children, the cancer itself, or sometimes the treatments needed, can cause issues with fertility or pregnancy. Plus, the treatments themselves can have side effects.
Okay, a lot to consider there. So let's shift to diagnosis and treatment. We know it develops slowly, usually with those precancerous steps.
And the Pap test is designed to catch exactly those steps, collecting cells from the cervix, looking at them under a microscope for any abnormal shapes, sizes, organization.
The early warning signs.
Exact.
And if a Pap test is abnormal, what's next?
Often, the next step is an HPV test, specifically looking for those high-risk strains we talked about.
Okay, and if that's positive or the Pap keeps showing issues?
Then usually you'd move on to other diagnostic tests. A colposcopy is common.
What's that involve?
It's basically using a special magnifying scope to get a really close-up look at the cervix. The doctor can see areas that look irregular much better.
And if they see something suspicious? Biopsy.
Yes, exactly. Need to take a small tissue sample to be sure. There are a few ways to do it. A punch biopsy uses a tiny tool to snip out a sample.
Okay.
Or an endocervical curettage, which involves gently scraping the lining inside the cervical canal.
Right.
There's also leap loop electrosurgical excision procedure that uses a thin electrified wire loop to remove the abnormal tissue.
Sounds precise.
It is. And sometimes, if they need a larger sample or need to see deeper into the canal, they might do a cone biopsy, removing a cone-shaped piece of tissue.
So the biopsy confirms if it's actually cancer.
Correct. And if it is cancer, then more tests are needed to see if it has spread or metastasized.
What kind of test?
Things like blood tests, urine tests to check liver and kidney function, imaging like x-rays of the chest or bowels, maybe CT scans, MRIs to see if it's gone anywhere else.
And all that information helps determine the stage.
Precisely. Cervical cancer is staged from stage I, meaning it's just in the cervix, up to stage 5, meaning it's spread quite far. Your doctor explains your specific stage.
Got it. And you mentioned looking at cells under a microscope. What do cancer cells actually look like?
Well, to a pathologist, they look different. They might vary a lot in size and shape. They lose their normal organized pattern, maybe look like they have more fluid inside, and the center, the nucleus, often looks darker. But again, you need a trained expert eye to see that.
Right, not something you see yourself.
Yeah.
So once it's diagnosed and staged, how are treatment decisions made?
It's very individual. It depends heavily on the stage, of course, but also your age, your overall health, and importantly, whether you hope to have children in the future.
Makes sense. And what are the main treatment options?
The mainstays are radiation therapy, chemotherapy, surgery, targeted therapy, and immunotherapy. And sometimes clinical trials are an option too.
Can you briefly touch on each? Radiation.
Sure. Radiation uses high-energy beams to kill cancer cells. It can be external, from a machine outside, or internal, called brachytherapy, where they place radioactive sources right near the tumor.
Chemotherapy.
Chemo uses drugs, usually given IV or sometimes as pills, to kill cancer cells throughout the body.
Surgery.
Various types. It could be removing just the cancerous tissue with lasers, or freezing, which is cryosurgery, or it might mean removing organs like a hysterectomy, removing the uterus and cervix, or a trachelectomy, which removes the cervix but leaves the uterus, potentially preserving fertility. In very advanced cases, sometimes a major surgery called pelvic exenteration is needed.
Okay. And targeted therapy and immunotherapy, they sound newer.
They are, relatively. Targeted therapy uses drugs that go after specific weaknesses in the cancer cells themselves. Immunotherapy helps your own immune system recognize and fight the cancer more effectively, like taking the brakes off the immune system.
Fascinating. So, the big question, can cervical cancer be cured?
It's highly treatable, especially when caught early. Doctors often prefer the term remission, meaning no detectable cancer. But cure is definitely possible, particularly in early stages.
And treatment varies by stage, like stage I might not need chemo.
Often not. For stage I, surgery is frequently the main treatment, sometimes followed by radiation depending on certain factors. Chemo is used more often for later stages or if the cancer comes back.
What about stage 4? Is remission still possible?
Yes, even at stage 4, while a cure is less likely, achieving remission is still possible with treatments like radiation, chemo, and targeted therapies. The goal is often to control the cancer and maintain quality of life.
That's good to know. Okay, let's wrap up with prevention. We've hit this a few times, but it's worth reinforcing.
Absolutely. Prevention is key. So number 1, regular gynecological exams and Pap tests as recommended for your age group.
Crucial. What else?
Get the HPV vaccine if you're eligible. It's incredibly effective.
Right. Safer sex practices.
Yes. Using condoms or other barrier methods consistently and correctly helps reduce HPV transmission risk. Limiting your number of sexual partners also lowers your exposure risk.
And smoking.
Stop smoking. Quit tobacco. It significantly lowers your risk, not just for cervical cancer, but for many other health problems too.
Okay, so summing up. Cervical cancer is serious, no doubt. But the key takeaway seems to be that it's very treatable, especially if you find it early.
Exactly. And we have powerful tools for finding it early, screening, and even for preventing in the first place: the vaccine, not smoking, safer sex. Regular screening and prevention measures are just paramount.
So if you're listening and you experience any concerning symptoms, we mentioned bleeding between periods or after menopause, weird watery discharge, pelvic pain, pain during sex, please talk to a healthcare provider. Don't delay.
Please don't.
And even if you have no symptoms, make sure you're up to date with your screening schedule. It's one of the most important proactive things you can do for your health.
Absolutely. Understanding this disease, taking part in screening, using preventative measures, it really highlights how much power we have in managing our health proactively. Early detection makes such a massive difference for cervical cancer outcomes.